Again. This is the third and hopefully the last thing we're going to end up doing regarding studying for this next quiz thing. And then we'll do our test ones. Yeah. Well, anyways, coming up right now, we're talking about hepatitis, which is itis being inflammation, and then hepatic meaning the liver. So we talked about cirrhosis of the liver last time, which is just this, it's kind of this almost chronic damage of the liver that occurs just because the liver's been working too hard for too long. Hepatitis, though, is just simply inflammation. You can get hepatitis from things that will eventually cause cirrhosis. This is more of, I would say, it is just the act of it being damaged, right? So in cirrhosis, let's say this inflammation has been happening for a long time. That's why fatty liver disease is part of this process of hepatitis, is because it is causing inflammation, it's causing damage. Cirrhosis is the buildup of all that damage and over time, and it just happens to be that there are other things that can cause inflammation other than kind of iffy lifestyle. So, we talked about fatty liver disease and what that looks like and the things we can do to, not have as many of those issues. There's a couple other things that can happen. Immunologic damage, and that one is interesting. That's going to be your autoimmune issues. Any sort of condition that would cause your liver cells to be attacked by your body, which can sometimes happen, that's just that. And then, unfortunately, that can happen practically anywhere, which kind of sucks. But, that's one thing that can cause that inflammation. Because inflammation in the body tissues is a result of stress and damage occurring. It's part of the immune response. The inflammation cascade, basically, or a bunch of different things are released as like, hey, help, what the heck, bring in somebody right now, things are looking bad, and so that's what inflammation looks like, and immunologic damage can cause that. The next one we're going to go for is toxic damage, and we'll save infections for later. Toxic damage, we talked about how fatty liver disease, that let's consider that mostly a issue of too many fats, too much sugars. Toxic damage, okay, which can impact our case here for fatty liver disease, is the fact that your liver is constantly having to filter stuff. It is constantly having to clean out all this gunk in your blood before it goes back to the heart. So that's cleaning out any alcohol, drug parts, poisons, and chemicals. No matter if those things are all going to kill you, even if you just got them and they're going to kill you, your liver is still having to try and clean it out. The liver, if the body looks at everything else in the blood and says, boy, that's not supposed to belong here, it's like, well, don't worry, the liver will take care of it. And unfortunately, the liver has to take care of it. It's kind of a bummer, but that's just the way that it is. So, now with alcohol and drugs, right? It's usually more of a long-term process, right? Like, one drink of alcohol is not going to cause hepatitis, but long-term abuse of alcohol and drugs, and those can be over-the-counter, prescribed, and illicit, any type of drugs that are filtered through the liver, which is basically everything. 90% of things that are going in your blood, anything that goes into blood circulation, goes through your liver, right? So, kind of a bummer there. And then poisons and chemicals. Through the same processes that alcohol and drugs cause damage, poisons and chemicals cause damage as they travel through the bloodstream, through the liver. And the liver says, hey, this isn't supposed to be here. And by pulling it out of your bloodstream, the liver can injure itself. But the liver is a really selfless organ at the end of the day. And then lastly, infections. Now, especially like pathogens that are traveling through the blood, and that's the reason that this causes the inflammation, is they travel through the blood, get to the liver, and cause damage there. They hang out there. They like chilling in the liver. And it can be any of these guys, any of these microorganisms, viruses, bacteria, fungi, protozoa. All these things can cause an infection in the liver, causing inflammation, because that's the body's natural response to being somewhere they don't like to be, or being somewhere that they're being damaged. Inflammation is a response that happens to not only try and fight back at the site where, the damage has occurred, but also to signal to the rest of the body, like, hey, something's wrong, send in the cavalry, kind of a thing. So now the different types of hepatitis. It doesn't really go into a whole lot more than, hey, by the way, hepatitis is inflammation of the liver. Here's how you can get inflammation of the liver. But that includes all of these different forms of hepatitis. Now, you'll notice that like all of these are infection-based. In fact, practically all of them are virus-based. They are just viruses that specifically target the liver and cause inflammation there and damage that can occur. So we're going to go through all the different hepatitises, A to E, talk about a couple of the different like treatments and etc., and then that'll be it. So hepatitis A is the first one we're going to go from. We're going to go from A to E alphabetically. Hepatitis A is transmitted, I like to say poop to mouth, and because it is the fecal-oral route, which, if anything, says something about the actual means of transportation. It is not that this person is eating poop on purpose, right? It's just simply that in the process of bringing something into your mouth, it was infected with HAV, which is hepatitis A virus. Now, this can happen because you didn't wash your hands before you ate food, or the water was contaminated, or the food was contaminated, you put it in your mouth, or you ate the food raw and it had this virus on it. It comes down to you put something in your mouth that was infected, okay? Hepatitis A can be chilling on your hands, so if you're putting your hands in your mouth all the time, you could be putting hepatitis A in there. Straight up, there you go. So, in this case, getting a hepatitis A is as simple as, not practicing good hand hygiene and not, considering what kind of foods might be carrying what kind of things. So they even have here that flies can carry hepatitis A, just because, look at them. They're not washing their little feet when they travel from food to toilet seat, listen, like, which, means they can carry lots of diseases, these pests, but unfortunately, that means that, there's only so much you can do to prevent getting hepatitis A, so it's just doing your best to follow, do the kind of things that are going to limit your exposure. Hepatitis A is destroyed by bleach and high temperatures. So, bleach you're not going to be eating, but, if you're cleaning things that need to be cleaned like that, then bleach is great. And when it comes to raw food, remember, temperatures greater than 195 degrees Fahrenheit will burn away that nastiness. So, hey, just keeping that in mind. Overall, though, hepatitis A has GI manifestations, so nausea, vomiting, diarrhea, cramping, other stuff just like that. Nothing, there's no there's no flu-like symptoms. At least there's not usually flu-like symptoms, which we'll see going in the next couple of types of hepatitis. The incubation period is 15 to 50 days. And this is going to be more frequent if you've been kind of traveling. You'll see that in the United States, Canada, parts of Europe and Australia, it's kind of low to getting HIV, or it's not HIV, sorry, HAV. But you can see in other parts of the world the prevalence is much higher, which can be due to just different food and water contamination, stuff. Some people or some countries don't have the clean water that we're used to having, which can sometimes mean that if you travel, right, and you don't, wash your hands frequently before you eat, or you're drinking the water from the wells and things, it means you can sometimes get hepatitis A. Which sucks, and it's not fun because you're pooping, you're feeling bad, you're vomiting. It's not fun. But there are like different vaccines and stuff for this, and so we can talk about this. But yeah, so we talked about proper hand washing. Listen, washing your hands is never a bad thing. If you wash your hands, you're doing fine. Like, washing your hands is never going to be like, oh, well, I didn't have to do that. It's good that you did. Drinking bottled water, again, that's more if you go into other, countries. I'm not going to sit here and say you need to always be drinking bottled water. And, if you just go to somebody's house, you don't know. I mean, like, at the same time, taking the proper precautions if you're going somewhere where the water isn't treated, the way that it's treated here, sometimes can be wise. You can also receive the HAV vaccine before traveling to areas where the disease is common. So Mexico and the Caribbean, hey, it works, and we're really lucky to have a vaccine that works against this so that you don't have to worry as much about, well, I gotta, bottle the water, and I gotta do this, and I gotta do this. Now, is it still smart to do those things? Yes, it is, because it's a vaccine. It's not a cure, right? It's just there to help you, if it was to happen. That being said, it is always it's always a thing that's available if you're planning on going to any of those places, especially if you're planning on living there for much longer than like a week or so, right? Receiving the vaccine if living or working in enclosed areas with others, like college dorms, correctional institutes, daycare centers, long-term care facilities, and that's just because those places can be a little uncleanly. You never know when/where/when, where, what, why, how people's hands have been or feet have been, or if they've really cleaned up after themselves at the end of everything. So, yeah, that's all I'm going to say. Now, I live in a college dorm, and I have not gotten the HAV vaccine, or whatever. And all I can say to that is, well, I haven't died yet, okay? I have not died, and I haven't pooped/vomited my way through this, place. So, it's pretty rare, though. I live in America. It's pretty rare. However, right, something to think about, especially if you're doing in any of these places in, a place has less water treatment options or etc. And then an immunoglobulin infusion within 14 days if exposed to the virus with severe symptoms. And so, the truth is that vomiting and diarrhea, if it's extreme enough, could kill you, 100%. You could go into a hypovolemic state to the point where your organs aren't being perfused, and that can be a really, really bad thing. And it's just overall incredibly uncomfortable. It's a hard way to die. Let's be real, okay? Yeah, so if you've got these crazy symptoms and there's no other thing to do, you've got it, they'll give you an immunoglobulin infusion, which, if I remember correctly from Micro, it is essentially, it's human, so it's the antibodies. That's the antibodies that somebody else has made against the HAV virus, or just antibodies in general, that now, instead of your body having to learn and manufacture them on their own, now you just get this infusion that fights the virus for you. And it doesn't do a whole lot for your long-term prevention of getting HAV again, because your body, eventually the immunoglobulin infusion will run out, and your body will be like, oh yeah, maybe we should have written that down. We're probably fine. But it is a short-term solution, and it can save people's lives if the symptoms are severe enough. But it's usually self-limiting and, stops on its own. It just sucks. It's just not fun. Nobody wants to be pooping and peeing during their, trip to the Bahamas. That's not fun. But if this does continue past a week, they might give you an immunoglobulin infusion, because during that whole week, you'll have been absolutely projectiling out of all of your GI system. It won't be fun. But yeah, that's hepatitis A. Yeah, poop to mouth. Now hepatitis B. Okay, hepatitis B, and you'll notice like these kind of, I like to think of A, right, it's self-limiting, it kind of usually goes away on its own. A is kind of the least of a, oh no, you have hepatitis, it's just A? Okay, well it could be worse, right? And the farther you get down, at least to C, you're kind of like, oh, this is really not good. So, hepatitis B, you can get hepatitis B a bunch of different ways. At the end of the day, though, it comes and it's transmitted from your body fluids. So that could be your, like, semen, saliva, blood. Yeah, you can get hepatitis B from those body fluids and the way that it's transmitted. Okay, so you can get hepatitis B from unprotected sex, which that's kind of like it's a way that it's transmitted. But I mean, by just if two people that don't have Hep B have unprotected sex, they probably won't get Hep B, but it is the way that it's spread. You can also get it through contaminated needles, because one person's blood, you take this needle, it was been used before on them, and they're like, here you go, man, why don't you shoot up with the same needle that I just did? Wow, that sounds like a really good idea. And then boom, there's Hep B. Hemodialysis, for the same reason, if the machine hasn't been cleaned correctly, and somebody just went through it and they had hepatitis B in their blood, then wow, that sucks. Now you have it. Not great. It can also be passed to the fetus through the placenta, maternal fecal route, or fetal route, and then it leads to an increased risk for chronic liver disease. Hepatitis B is less of a cool, fun, awesome, like, well, I pooped for about a week and then everything was fine. Hepatitis B is a little bit more of a risky as far as it goes with prognosis. Signs and symptoms. These are going to be a lot more than just nausea and vomiting, unfortunately. So these signs and symptoms can occur within 25 to 180 days of exposure. So you can live your life for, goodness, that's nearly 3+ weeks without knowing you've been exposed to hepatitis B, which can make things easy to forget. Like, oh, when did you do that? When did you do this? And it can make things difficult to look down from a public health perspective, right? Somebody with Hep B, you're going to have to do a lot of looking, right? Because 25 days to 180 days, I mean, I forget a lot that happens. Ask me what happened 25 days ago, and I'm going to have to pull up my calendar and, scroll a lot and, oh, did I do that? So, high number have no symptoms or do not report, which is difficult. And you'll see why, because most of the time, it just looks like nausea, vomiting, anorexia, and flu-like symptoms, which you can just get from getting a little bit of a stomach bug, which, is not great when being able to actually take these signs and symptoms and say, oh, maybe I have Hep B. Maybe I should get treated for Hep B. Most people will just stay at home and be like, must just be a little bit of a little bug. I'll be fine. LOL. All right. Sorry, I had to yawn. Fever, fatigue, just your typical looking stomach bug problems. The things that can signal the red flags that you might have a hepatitis problem is going to start with right upper quadrant pain. Remember, that's kind of the area that the liver is chilling out at, okay? And if you've got pain there, that's got to be a red flag of, hey, maybe something's wrong with my liver. Maybe something is happening there. And absolutely, yes, there's something is happening there. It's inflamed. Dark urine with light stool. Now, this concentrated dark urine with light stool, I want to check out exactly why is my urine concentrated Hep B. All right. Due to the presence of bilirubin, a yellow pigment produced when red blood cells break down, causing it to be excreted in your urine, making it appear darker in color. Well, that's very, very interesting because I know that bilirubin can also be gotten rid of via the rectum. Dark urine. Hey, I mean, the bilirubin as well. So bilirubin is supposed to be taken out of your rectum. I remember that. And the reason it's being secreted with your urine here is because it was never taken out of the bloodstream, right? Your blood's waste products are excreted through your kidneys, right? So that's your pee. And normally, the liver dumps its bilirubin down that common bile duct into the duodenum, whatever. I don't care. And so that it can be just pooped out, right? Well, in this case, that's not working. The liver is unable to filter out the bilirubin from the person's system, causing it to have to go through the kidneys. And the kidneys don't like to do that, actually. They don't like that. I'm going to say, what? Because I don't think that's... Does bilirubin do to your kidneys? It's not good for them. Progressive effect on the kidneys and may help slow the progress of a protective effect. Well, hold on. That's crazy. Bilirubin's anti-inflammatory blah, blah, blah. Lower serum bilirubin are associated with a greater kidney function decline. Okay. High levels of bilirubin can damage the kidneys. Okay, so I was like, can it both have toxic and protective effects? That does make sense. So high levels of bilirubin can be nephrotoxic, but it can also reduce oxidative stress. But mildly elevated bilirubin levels are fine. It's just the big levels. So I would say probably long term, this high bilirubin in the urine is not super great, but short term, it doesn't do anything bad for them. It just causes your urine to look really concentrated. And then light stool. And it has to do with bile. I wrote it down, bile not working, leading to the lack of pigment that gives stool its brown color. So the reason your poop is brown is because you have bile in it is crazy. That's so interesting. Oh, that's so interesting. So without the bile production, your stool doesn't have the poop color. Hey, brother, I don't make the rules. Causing your stool to be light or clay-colored. Joint pain. Now, that joint pain is interesting. Because, yes, I have here written inflammation, but if this is like generalized joint pain from just the fact that there's an issue with your like liver, I want to know why exactly. Why joint pain? Hepatitis B. The body's immune response to the virus can trigger inflammation in the joints. Alrighty, well that makes sense. So it is a systemic response to the virus, and any sort of inflammation is just due to your immune system going like, all right guys, let's get them, let's take them out. So any sort of like inflammation you can consider as part of that process of the immune system freaking out, which causes joint pain, unfortunately, and that sucks. Nobody likes that. And then, of course, jaundice. Now, this jaundice would probably not be... This is not your, like, first thing that's going to happen. Jaundice is a progressive issue that happens when that bilirubin that's been in the bloodstream, right, and we've been peeing it out, it has just become too much, right? We are unable to get the bilirubin out, causing the yellowing of the skin. and jaundice and icterus and all that stuff. The good news with Hep B, though, is if you get better, you get immune. So if you were to get the virus and then beat it off, okay, that sounds, beat the virus away. How about that? Okay, shut up. To win, essentially, win the little virus war, you're immune. Your body's like, we know how to beat Hep B now. We're good. Let's move on. And that's why everybody gets the Hep B vaccine now. Yay, because nobody wants to deal with this. This stuff is not fun. It's not cool. And it's really hard to figure out if you've gotten it or not. So, if you happen to get the HPV infection, okay, you haven't been vaccinated or whatever, you want to make sure that you're not doing any of these risky activities with anyone. All right, you don't want to be spreading that around. Okay, now most people get the HPV vaccine, well, the Hep B vaccine, just as part of the typical vaccine regimen that kids get. Now, if people don't want to get their kids vaccinated, then you got to be really worrying about doing all of these things, because now there's a chance that you could have Hep B or that other person could have Hep B. I'm just saying. But so family members, household members, and sexual contacts of people that have a known HPV infection obviously should get the vaccine. If they haven't gotten it and they know that somebody who they are close with and might potentially share any sort of bodily fluid with have that vaccine or have it or whatever, they should get that vaccine. Just it's the smart thing to do. People with any chronic liver disease, hepatitis C or cirrhosis, these are not good for the liver. Getting these viruses are not good for the liver. It can lead to permanent damage and scarring. So obviously, if you've already got issues with your liver, don't make those issues worse by being irresponsible and getting a Hep B issue. I mean, just a thought, maybe just an idea, just a little thought I just had. If you have a sexually transmitted disease or a history of one of them, you're just at a higher risk for getting Hep B just because of the history. HIV patients, remember, those patients are immunocompromised. Their T4 cells are dying. They're being killed, insidiously destroyed. So we don't want them to have to worry about getting that, because their immune system's not going to be able to fight it off as effectively as somebody who doesn't have HIV. Healthcare workers, firefighters, and police, just because those are going to be people that maybe they're going to be coming into contact with bodily fluids. They're going to be seeing a whole lot of people from a whole lot of backgrounds, and it's better to be safe than sorry. Incarcerated individuals, just because there's all sorts of, chance for body fluid transmission there, and all sorts of varied histories in prison. People who take on those high-risk behaviors, so any of these things, okay? Boom. Well, basically just unprotected sexual intercourse and contaminated needles, IV drug use kind of thing. Those are we're worrying that maybe they could get Hep B. And then patients needing immunosuppressant drugs for the same reason that we're worrying about the HIV patients and just making sure that they take care of themselves and get this vaccine. We'd love for people who are taking those drugs that suppress their immune system to also get one, because they will be less able to effectively fight off the hepatitis B virus. All right. Hepatitis C. All right. So hepatitis C is just blood. Okay? Blood and also semen. There it is. But the hepatitis C is a more chronic issue. This is our big oops, oh no, Hep C moment. We don't like Hep C. It's a bad one. It's a bad one. Up until recently, and even then, it's still kind of under trial. There wasn't like a cure for it. There wasn't even like a big treatment for it. But now they are started to have this treatment, which is a lot of like a big massive chunk of medications that all work to fight off the virus. So, but that's still being tested. It's still being researched. Hepatitis C is not as terrible as it used to be, but it's still not good, and it can still do a lot of damage to the liver. So anyway, we talked about the way that it's transmitted from blood to blood, and it can also be transmitted through unprotected sex, especially if you've got multiple partners, because, hey, lots of people got lots of things. Same thing with the contaminated needles. Also sharing cocaine stuff. Sure, dude. But the issue with this one is that the virus is always there. It will always be there, and you will always have Hep C. Although now we've got this cool treatment with a 95% cure rate. Now remember, this is still in its fledgling stages. It's still being kind of researched and tested. But that's pretty good. Right now, with the current research, that's pretty good. But long term, if left untreated, you're going to be having this for probably the rest of your life, and it's going to cause liver damage throughout that time. Now, you're not going to be transmitting this through, like, kissing or, like, mosquito bites. You don't have to worry about eating utensils, because that's just saliva. Hugging, of course, will not transmit hepatitis C, and using the same towel won't, unless, I don't know, like, you have a cut in your mouth with the kissing, or, you're using a towel that's covered in blood. Like, don't share razors, toothbrushes, earrings, just because those are all things that have the risk of just micro tears. Little micro tears in your skin that you don't even notice. But in that time, the hepatitis C virus can get right in there. So, not fun. Hepatitis D. Now, hepatitis D is almost like Hep B+, okay? Now, you're going to notice as we go through hepatitis D and E that they have little partners, okay? Hepatitis C is all on its own, all right? And you know why that makes sense? Because hepatitis C is in the middle of all of these, the alphabet numbers here. A, B, C, D, and E. It's in the middle, which is kind of nice. But yeah, with hepatitis D, you're only going to get hepatitis D if you've had hepatitis B. So somebody with hepatitis B might not get hepatitis D, and somebody who has hepatitis D has had hepatitis B in the past. Okay? Now, just like with hepatitis B, hepatitis D is a parenteral sexual transmission issue, but the symptoms and the treatment are the same. It is just simply a variant of the Hep B virus that can occur when, it essentially just morphs and changes into this, which is cool and stuff. Hepatitis D. So the symptoms for hepatitis D are going to be those flu-like symptoms with some nausea and vomiting, which may progress to right upper quadrant pain, jaundice, dark urine, light-colored stools, etc., if left untreated. But the treatment of being vaccinated and all that stuff is the same. Although, does the Hep B vaccine work for Hep D? Yes, it does. Well, how nice. Okay, so yeah, the same vaccine works, which is cool. Cool. No FDA-approved treatments for HDV. Antiviral medications may be helpful, but they have some side effects. Liver transplant may be considered for patients with advanced cirrhosis. So, essentially, what you're looking at here with hepatitis D is that it is Hep B+. So Hep B can be treated if you get the Hep B vaccine. Hep D, though, there are no FDA-approved treatments, which is bad. So you don't want hepatitis B to transform into hepatitis D, right? It looks the same, but it is essentially a much harder to combat version. Now, hepatitis B vaccine protects against hepatitis D. So if you've got hepatitis B, it's like, okay, well, grab that Hep B vaccine right now, because you don't want it to get worse or to mutate into this much harder to treat form. And then hepatitis E, our last of the hepatitises for now, is this one is going to be an enhanced version, just like hepatitis A. So it occurs with the fecal oral route, and it can happen, just at any time. However, this one also, just like hepatitis A, resolves on its own, which is kind of annoying. Now, this is just a overall review of all of the things that hepatitis can look like, okay? Now, remember with A and E, which are our fecal oral routes, you're going to be looking at more GI symptoms than with any of the other transmitted routes that are parenteral with B, C, and D. Those guys are going to be more of the flu-like symptoms. But any of these left unchecked can lead to that right upper quadrant pain, jaundice, icterus, joint pain, changes in the urine color and the stool color, itching, all of those signs and symptoms of, hey, the liver's not working at its full capacity, we've got waste products chilling in the blood, and it's not a good situation. Laboratory assessment, especially at the beginning, you'll be having acute elevations of liver enzymes, that AST, ALT. They are going to be showing elevation, meaning that the liver is under attack, and they'll give us the ranges for those on the test. You might also see your anti-hepatitis antibodies, IgM, IgG antibodies being raised up. So the markers for HBV are Hibs, AG, and just the idea that your body is making the antibodies, essentially. And if your body is trying to make antibodies to fight HBV, specifically HBsAg and anti-HBsAg, so hepatitis B and antigens and the anti-antigens. So we'll see, they have an HBV infection. They also have this OraQuick HCV rapid antibody test to test for hepatitis C, and then these same antibodies for HDV and HEV. Essentially, it goes into a blood test, getting that culture where it says, hey, what do they got in here? Like, what kind of antibodies is the body trying to make? What kind of antigens can we find in the blood? And by testing for those, they can figure out how they can best treat this issue. Because if they see those liver enzymes are elevated, and there's any sign, maybe they've been to another country, or they're an IV drug user. Hey, it's never those are clues that can tell you that something like this might be ordered for that patient. Other assessments that they might do is a liver biopsy, just to figure out, hey, like, is this actually hepatitis? How much has the liver taken already? Like, how damaged is it? Because you can also use this to establish the grade and stage of liver damage, which, we talked about, that can consider, like, how bad this damage has been. And especially if somebody who's just gotten hepatitis has got, like, a fatty liver issue, or they've, got a history of, like, fibrosis, like, and scarring on that liver in the past, it's almost a benchmark of, okay, well, how bad is their liver doing really? So a liver biopsy can help with that. And of course, ultrasound. We talked about elastography, or elastography, I don't remember, but it's essentially that ultrasound, or I think they also said MRI imaging, that can help to consider, like, how much damage and what the surface of that liver looks like, to consider how much damage it's been through. Medications for hepatitis. They have here a page of antivirals for us to go over, but I've got a little list here. we will go over those antivirals actually in a second, just kind of on our own. But essentially it comes down to we have immunomodulators. Now, why would we want immunomodulators? Because they suppress the immune system. Why would we want to suppress the immune system? Well, and simply, especially for somebody who maybe has hepatitis C, the reason that their liver is being messed up right now is not because of the infection. That's an important thing to recognize, because the infection itself, the body doesn't like the infection. Our body is very xenophobic. So it sees this infection and goes, kill it, kill it, kill it. And unfortunately, our immune system, it doesn't really have like sniper rifles. It has more like hand grenades. So it just chucks the hand grenades into the liver, and it's like, well, some of our organs may die, but you know what? At least we got the invader out. Well, especially if you've got a long-term infection, you're just going to be having that liver just be beat up by your own immune system until it finally can't liver anymore. And now we've got an even bigger problem. So long-term, immunomodulators may be prescribed by a physician to suppress the immune system, just so that it is less likely to destroy your liver right then and there. So of course, with immunomodulators, you're wanting to educate that patient about what it looks like to be infected, especially subtly, because their immune system is the thing that makes you feel all the certain ways you feel when you get sick. That's what makes you feel a little nauseous. That's what makes you feel like, oh, well, I've got this really, this malaise, and I feel nasty. Those signs and symptoms are going to be a lot more subtle when you're on an immunomodulator, because the immune system is a little bit drugged out, okay? So just slight variations in temperature, a bit of flushing perhaps, I just didn't feel I didn't feel great today, something felt wrong. Those are things that, as somebody who's on immunomodulators, you have to be kind of cognizant about, because that could indicate you've got something worse going on, and you need to get that treated. Of course, you want that person to be washing their hands and avoiding crowds if they can, just to limit their exposure to little nasty bugs out there. These people may also be prescribed antivirals that might try and kill the virus. The antivirals may make a person lose their taste or taste weird things. Might also give them nausea and vomiting and abdominal discomfort. But that is unfortunately pretty frequent with a lot of medications. The big thing with antivirals, and this has always been the massive thing that you need to know about antivirals, is that they're only effective. Sorry, there's like a little gnat. I don't know if I killed it or not. The big thing you need to know about antivirals is that they're only effective if they're given within 48 hours of the signs and symptoms. Like once the signs and symptoms start. And I mean start. Like, oh my goodness, I'm feeling a bit of right upper quadrant pain. Maybe I feel a little bit like, maybe I got like a flu. You've got like 2 days to figure out if it's a virus, or go in and say, hey, I'm not feeling good. And if, you just try and kind of tough it out, which most people will try and do, when you're, like, let's say you're in, the ER and you've heard that, I got these feelings, probably like 2 weeks ago, but I haven't gone in because I thought it would go away. Well, now I'm here because I need help. Well, if that person has a viral infection, antivirals after 2 weeks probably aren't gonna do the job, because by then the virus will have replicated so many times that those antivirals are really going to be not really doing much at all. Nursing priorities for a person with hepatitis, any sort of issue where the body's not filtering out its waste products very well is going to result in some fatigue, as well as the fact that their body's not going to be, since their liver is hurting, they're not going to be dealing with any of those vitamins, those fat-soluble vitamins as well. So they're going to be needing a lot of rest. They're going to want to have vitamin-rich foods, because they're not getting as much of those vitamins as they might need, and they won't be able to pull out as many of them as they would be if their body wasn't having an issue with its liver. And of course, pain. That right upper quadrant pain is not fun, and I think for that person, making sure that you're monitoring that and adjusting for their comfort is good. There's also going to be some patient and family education that needs to happen, because remember, depending on the type of hepatitis, this person may have to change a lot of things in their lifestyle. There may be some things that, you're going to have to make sure that you don't share any razors and don't share any toothbrushes or anything like that. Don't, careful with sharing if you've got a really, really sharp comb, I don't know, anything that can cause blood to be transmitted. Avoiding medications, including over-the-counter drugs, unless prescribed by the physician. And that's because a ton of drugs, put the patient at risk for hurting their liver. A good solid chunk of medications, they are all filtered by the liver. Right? A good solid chunk of them are filtered by the liver. And if the liver's not doing very well because there's a war happening in the liver right now, those medications, including acetaminophen, which you can just buy at Walgreens or whatever, those are going to hurt. They're not going to help the situation. So making sure you tell the patient, make sure you've talked to your doctor and told him what kind of medications you are taking, or get him or her to sign off on, this is what you can take, this is what you can't take, because it's really important you don't make that problem in the liver worse. Avoiding alcohol, again, because alcohol is technically a toxin to your liver, which it has to filter out. So the less that the liver has to do as far as filtering out alcohol, the better. Avoiding sexual intercourse until antibody testing results are negative. You do not want to be sharing that around. It's just irresponsible. And then following the guidelines for preventing transmission. Once again, if you've got it, don't spread it around. And of course, that depends on the type that you have, right? I mean, with hepatitis A, it's not going to be I can't, do this because I have hepatitis A. I can't share, a razor with you. Well, so hepatitis A is fecal oral route. You don't have to worry about it like that. But if you had hepatitis B, C, or D, yeah, we'd be worrying about that. Keep your razor to yourself, kind of a thing. All right, prevention. Of course, prevention. We would rather not have this be a problem. I'd rather not have to say, oh, well, I've got hepatitis B, so now I can't do all these things and I can't do this or whatever. I have to be careful about this. Let's just not ever get it, right? So using standard precautions, washing your hands, making sure there's a barrier if there's any blood involved. Don't just, just careful. Just be careful. Eliminating needles and sharp instruments by substituting needleless systems. Needles, they're pokey, and the whole point of needles is to get into the bloodstream, right? So, especially if somebody is using IV drugs, maybe don't do them IV if you possibly... I don't want to say you should just do drugs, of course, but the actual instruments, the IV or the needles used are what are putting you at risk for just getting that hepatitis in your system. So let's not do that. Of course, getting the Hep B vaccine. That's a big one. By getting the Hep B vaccine, you're knocking out hepatitis B and hepatitis D just by getting that guy. So really important. And then for post-exposure prevention of HAV, seek medical attention immediately for immunoglobulin administration. Because you may have gotten it. If you're worrying about getting it because, oh my goodness, I ate a hamburger and I realized afterwards that it was super raw, but I didn't recognize it, and I don't know if I have it or not, just go and, they might be able to give you something just in case, so you don't have to worry about that. Because, yes, you'll get over it, but it'll cause damage in the meantime. And of course, reporting all cases of hepatitis to the local health department. This is a requirement, right? This is mandated because we want to make sure, and the public health department wants to keep an eye on hepatitis B and well, all of the hepatitis, actually, all of the hepatitis, so that it can prevent spread. Hepatitis is a really bad situation because the liver does a lot for us, and even just a little bit of hepatitis can do a number on your liver if left untreated. And of course, there's always a chance. Now, this is an end stage treatment. For any of the things we've talked about with the liver, there is always a chance you can get a transplant. Now, liver transplants are common, they happen a lot, but nobody really wants to get a liver transplant because, like I said, the body is very xenophobic. It's going to look at any other liver other than your own and say, what the frick is that? How about we destroy that thing, huh? How about we know that? How about we get rid of it? Okay? And so this person who's just had this liver transplant, they have to know they're going to be taking immunosuppressants for the rest of their life to keep their body from destroying this liver that they have. Okay, that is incredibly important for that patient to understand, to know, because if that ever stopped, or if there was ever a chance that could stop, it could lead their body to rejecting their liver entirely, completely destroying it, and putting them at risk for literally dying. And we're actually going to open up our MedSurg textbook and look up a table on page 1173, so we can just talk about the different stages of acute versus chronic rejection. Because when it comes to signs and symptoms, I think these are pretty important, just because rejection's a big deal. I mean, it's similar, in my opinion, to when somebody's getting a blood transfusion and they start to be like, I don't know, I maybe have some flank pain and I'm feeling really hot and uncomfortable. Yeah, red flags, alert, crying, screaming, stop the infusion. Like, that's where this rejection comes at to me, because once this happens, the body will have a allergic reaction to the liver. It'll go like, you've been here the whole time, and yeah, it's not a great situation. Okay, so acute versus chronic rejection associated with a liver transplant. All right. So, and these are complications associated, okay? So, with an acute graft rejection, this can happen from the 4th to the 10th post-op day. You're going to be having some tachycardia, a fever, right upper quadrant pain, or flank pain, diminished bile drainage, of course, because the liver's not working, it's being attacked, and increased levels of serum bilirubin, alkaline phosphatase, and prolonged prothrombin time. Of course, because the liver's not working. All of the things the liver normally does are now going to be stopped, or at least halted, slowed down, whatever, because now the liver is being attacked. Prophylaxis with some immunosuppressant agents is our prevention, right? But early diagnosis to treat is important, because if you can diagnose that, or not diagnose, if you can notice that and tell the provider can then just be like, we need stronger anti-rejection meds to essentially just knock out the immune system, to be like, shh, go to sleep, kind of a thing. And it works, right? But you have to catch it before the damage has been done. Yeah, that's it. They have this whole idea there's chronic. I'm not seeing anything chronic, although I do see late-term stuff. So in the acute phase, there's also an infection that can just happen due to the procedure, and it can happen at any time during the recovery, and it's manifested by your signs and symptoms of rejection. So fever, excessive foul-smelling drainage from the site, or coming from your urine. Other indicators can depend on location or infection type, and for this infection, the prevention is pretty clear with antibiotic prophylaxis, vaccinations, taking frequent cultures of tubes, lines, drainage, removing invasive lines as soon as they can be removed, good hand washing procedure from the people involved, and of course, early diagnosis and treatment with the stuff needed. And as the nurse, it's our job to make sure we're looking for those signs and symptoms, so that if any of these things do happen post the procedure, the physician can know about it, and we can get started on making sure that these problems don't get worse. And now the chronic stuff. Now they have 2 things listed here for chronic issues, and I think that they're really important to go over. Hepatic complications such as bile leakage, abscess formation, and hepatic thrombosis. So bile leakage. Okay, bile's leaking. Yeah. I'm gonna check that out because I want to make sure that that's what is bile leakage. Rare but serious condition when the bile leaks from the bile ducts to the abdominal cavity. Oh, great. So it's kind of like a bit of, yeah. Oh, that's not good at all. Oh, boy. Okay, yeah. So then it's leaking into the peritoneal space. Not great. Abscess formation, which is where you've just got a big chunky gunk thing there. And then hepatic thrombosis, which thrombosis means there's a blockage, like a blood clot, essentially, there, which is not good. And these are going to all be manifested by decreased bile drainage, increased right upper quadrant pain with distension and guarding, especially if there's bile stuck all up in there, nausea, vomiting, increased jaundice, and clay-colored stools. You'll also see increased levels of serum bilirubin, and transaminases, but we haven't talked about those very much. If present, keep the T-tube in dependent position. Remember, we talked about that T-tube in regards to a gallbladder, a cholecystectomy, taking out. And so if they do have a T-tube, making sure that there's no bile that's flowing back that's causing this issue, that's a good way of looking at it. Emptying that T-tube frequently and then making sure the drainage at the site is, staying pretty consistent and looks good. But of course, we want to tell the surgeon about any of these signs and symptoms immediately to make sure that they know, because otherwise they might need to go back up in there and close something up or change something or take something out. But yes, so not great. And then for our last deal here, it is an acute kidney injury. Now, in this this process, right, of the liver being through all this junk, all that other mess, okay, all the stuff that the liver should have been filtering out is now likely staying in the bloodstream and going to the kidneys. And the kidneys are like, what? What do you mean we have to deal with all this crap? What do you mean? What do you think? Is the liver doing nothing? Well, kind of, yeah. Not great, okay? And during this process of the liver being changed and transplanted, this person might be taking a lot of antibiotics. There's already a lot of changes happening. If albumin is low, right, there's this strange fluid imbalance where all the fluid is hanging out in the extravascular space. So there's not a whole lot of perfusion happening all over the body, leading to a decreased perfusion everywhere, but in this case to the kidneys, who are very sensitive to that. So this acute kidney injury can be caused by hypotension, by antibiotics, cyclosporin, acute liver failure, or hypothermia. And you'll notice if it's hypothermia with shivering, hyperventilation, increased cardiac output, vasoconstriction, akalemia, etc. And when, we'll notice that they're having this acute kidney injury if they've got some sort of change in urine output, usually diminished or very, very low, increased blood urea nitrogen and creatinine, signaling a damage to the kidneys, and electrolyte imbalances. Just because, how the liver, when it's hurting, it can't really do its job. Well, now the kidneys can't really do its job, and the kidneys are really important with balancing electrolytes, balancing our pH level, telling our body we need more, we need more red blood cells, helping regulate our fluid balance, and now all of that is kind of going down the drain. So we want to be monitoring our drug levels that have nephrotoxic side effects. Our liver can take a lot of damage, our kidneys a little bit more sensitive, okay? Now, most medications are going to hurt the liver, but there are some that are going to hurt the kidney. We talk about the difference between acetaminophen and ibuprofen, for example. Acetaminophen, bad for the liver. Ibuprofen, bad for the kidneys, right? So pick your poison when it comes to pain control and etc. Okay, so when it comes to a hospital, though, if somebody's taking a drug that could potentially hurt the kidney, and they've already had a liver problem, so we know that the kidney's been doing a lot of little extra work. We want to be monitoring for side effects and monitoring for those signs and symptoms that maybe something's going wrong. We want to prevent hypotension. We want to make sure that this person has plenty of fluids in the vascular space so that blood can get to our kidneys, so that our kidneys can actually be oxygenated. That is super important because our kidneys are really, really sensitive to, hey, why aren't we getting any oxygen? That's part of the kidney's job, is to monitor the oxygen levels in the blood and determine if our body needs more red blood cells or not. And yeah, just like we said, we want to be observing for signs of acute kidney injury and telling the surgeon, because when that happens, the physicians can say, okay, here's what we want to do. We want to stop these medications. We need to do this. We need to do this. And as the nurse, we can say, all right, we'll do that. I'm glad we were able to notice something was wrong and let you guys know. So that is it, actually, when it comes to hepatitis. Wow. And now we're done with that. What an exciting prospect.